Welcome back to Vetcare. Today we'll understand hypersensitivity in a clear and simple way. First, the basic idea. The immune system protects the body from harmful substances. When a substance triggers an immune response, it is called an allergen. Normally, this response is helpful. But in hypersensitivity, the immune system overreacts and causes damage. So, hypersensitivity is an exaggerated or harmful immune response. Think of the immune system like a farm security system. The first time a stranger such as allergen enters, the system does not react strongly. Instead, it learns and prepares by making special tags called immunoglobulin E antibodies, which then attach to mast cells. This stage is called first exposure or sensitization, and there are usually no signs. During the second exposure, the same allergen enters again. The body recognizes it immediately because immunoglobulin E is already present. The allergen binds to immunoglobulin E on mast cells, causing release of chemicals like histamine. This leads to a rapid and strong reaction. That is why the second exposure is dangerous. In one line, hypersensitivity is when the body overreacts on second exposure and harms itself. There are 4 types of hypersensitivity. Type 1 is immediate and occurs within minutes. It involves immunoglobulin E and histamine release, causing swelling, itching, breathing difficulty, and shock. The main example is anaphylaxis. Type 2 occurs when antibodies attack the body's own cells, especially red blood cells, leading to their destruction. In this type, the main antibodies involved are immunoglobulin G and immunoglobulin M. Type 3 hypersensitivity is different. Here, the antibodies involved are mainly immunoglobulin G or sometimes immunoglobulin M. Instead of attaching to cells, these antibodies combine with antigens in the blood to form antigen-antibody complexes. These complexes then circulate and get deposited in organs like the kidneys, joints, skin, or blood vessels. Once deposited, they cause inflammation and tissue damage. Type 4 hypersensitivity is slower and works differently from the first 3 types. It does not involve antibodies at all. Instead, it is controlled by special immune cells called T cells. These T cells react slowly after exposure to an antigen, usually taking 1 to 3 days to show effects. They release chemicals that cause inflammation and tissue damage. Now focusing on the most important type, type 1 hypersensitivity, also called anaphylaxis. It is a sudden, severe allergic reaction, affecting the lungs, skin, intestines, and heart, and may quickly lead to death if not treated. Common causes include vaccines such as FMD, rabies, brucella, and hemorrhagic septicemia, serums like anti-tetanus or anti-rabies, drugs such as penicillin and acepromazine, parasites like hypoderma and fasciola, diseases like glanders, brucellosis, and malignant catarrhal fever, as well as pollens, toxins, endotoxins, and blood transfusions. In pathogenesis, during second exposure, the allergen binds to immunoglobulin E on mast cells and releases histamine and other mediators. These cause vasodilation, increased vascular permeability, bronchoconstriction, and a sudden drop in blood pressure, leading to shock. In the lungs, there is breathing difficulty and fluid accumulation. In the digestive system and blood vessels, diarrhea and blood pooling occur. In the udder, edema and reduced milk may occur, and in the skin, itching and swelling are seen. Clinically, signs appear rapidly within minutes. Animals may show difficult breathing, excessive salivation, trembling, frequent urination, and urticaria. Body temperature may rise. In ruminants, bloat and udder swelling are common, while in horses, colic, diarrhea, and laminitis may occur. Severe cases may progress to death. Diagnosis is based on sudden onset of signs after exposure to an allergen. Lab findings may show increased eosinophils, high hematocrit, and low neutrophils. Hypersensitivity reactions in animals are managed based on severity, but the most urgent is type 1, which requires immediate treatment. The most important and life-saving drug is epinephrine, also called adrenaline, especially in acute or severe reactions. Corticosteroids are the main drugs to suppress immune and inflammatory responses, such as dexamethasone or prednisolone, which may be continued for a few days and then the dose is slowly reduced in long-lasting cases. Antihistamines like chlorpheniramine are given as supportive therapy to block histamine effects. Non-steroidal anti-inflammatory drugs such as flunixin meglumine in large animals and meloxicam in small animals help control pain, fever, and inflammation. Additional supportive care includes intravenous fluids, oxygen therapy if needed, and removal of the causative agent. While in horses showing colic signs, atropine may be used cautiously. Always keep adrenaline available during field procedures or vaccination and observe animals for at least 20 to 30 minutes, as early recognition and immediate treatment are critical to saving life. If you found this helpful, don't forget to like, subscribe, and stay tuned for more